community. We are back on NHAP with Monday Mythbusters. Today's very interesting topic we are here with is art therapy for anxiety. And I am wellness coach with NHAP, Ananya, and we have a lovely art therapist with us, Nada.
Hello,
Welcome you, Nada, with
thank you.
NHAP.
Nice to be here.
Uh, Thank you so much. Just in the time, just for 5 minutes till everyone's joining, let us
Mhm.
just understand what is exactly anxiety. If you could just throw some light on anxiety and how art therapy can connect to it.
So anxiety is a big topic, but what you start feeling with anxiety, your heart starts to pump faster. You have nausea. You have severe headaches. You can't sleep. You have sweaty palms. I don't know if I covered that. And upset stomach. So it's a lot of symptoms you have because of anxiety. Now, anxiety could be mild, it could be moderate, or it can be severe. With severe anxiety, you have a lot of panic attacks as well. Your heart starts to race. You really can't think straight. I think a little anxiety is good because it helps you get things done, go through things. But when it gets severe, that's when the majority of the people have problems. You won't be able
We
to
need
think
help,
straight. Yes, yeah.
right? I also would like to understand, is anxiety and stress similar, or do they have a different variety? I mean, are they different from each other? Anxiety and stress goes hand in hand?
They do go hand in hand, yes. So stress causes
Okay.
anxiety, and anxiety can cause a lot of stress. I think if you go under severe stress, that can cause anxiety. So you can't really separate the two.
Right. But I've also heard that little bit of stress is always good to push yourself, to prepare yourself for a difficult situation, to
Absolutely.
uplift yourself, right?
Absolutely.
But when it
Yes.
is severe, when it's out, when we are not able to handle it, that is when we need help from a therapist.
Exactly. And
Am I
then you won't be
correct?
able to think properly. You will have a hard time dealing with your issues and problems because you have extreme severe high anxiety that your whole brain is clouded. So you won't be able to deal with whatever's coming your way if you have severe anxiety, or if you allow your anxiety to become severe.
Perfect, perfect, Nada. Thank you so much. Just for our audience here, I would just like to introduce Nada. A little background about Nada. Nada is an MAAT, that is Masters in Art Therapy, and she is an USA certified art therapist with a double major in fine arts, with sociology and psychology. She has worked in various places from Montreal, Amman to Dubai, including refugee camps, shelters for domestic abuse and violence, conducted group therapy for mothers and children with special needs, and women empowerment. And
Mhm.
recently, she has been volunteering at Brighton College, Dubai, helping students with emotional and behavioral problems. Anything else you would like to add, Nada?
Yes, I also worked, I interned actually at Rashid Hospital, and that was also a great experience for me because I was doing art therapy on with a group setting and individually with my clients. So I was dealing also with inpatients and outpatients, and that was just a great learning experience and platform.
Excellent. There's so much for us to learn today. So I hope my audiences are ready. So let's start with the first myth of the day. So the first myth of the day asks or says medication is the best and the only therapy. Is that so, Nada?
Absolutely not. That's a misconception. And anxiety is definitely not the only medication to treat your anxiety. In fact, using the right combination of lifestyle, for example, social support, and it can be a family member or a friend, that's really important to decrease your anxiety. Having a healthy diet, meditation, as in yoga, that helps a lot, or just being in the present moment, as in mindfulness, trying to be in the present moment, that is a great way to decrease your anxiety. Now, keep in mind, we usually, individuals are either in their past, which causes a lot of depression, or we're always in the future, which causes a lot of anxiety and increases your anxiety. So trying to be mindful, trying to be in the here and now, in the present moment, definitely helps decrease your anxiety. Some grounding techniques, using your senses, also helps you decrease your anxiety. Positive self-talk is a really important one. Majority of the times, our self-talk is negative, and it's very critical and very self-judgmental. So if you have the ability to be aware of your self-talk, you can switch it to a more positive self-talk, and that also helps decrease your anxiety. Exercise is a great way of decreasing anxiety. Getting enough sleep also decreases anxiety. And you know what? Sometimes just breathing your anxiety helps. So these are just a few ways that you can decrease your anxiety without medication.
Perfect, perfect. So first myth is busted. The second one, you don't have to be an artist or have artistic talent to see an art therapist. Is this a myth or a fact?
Yes, this is definitely a myth. Absolutely. It's a misconception. We don't,
Absolutely.
first of all, this is not an art class, so I want to make that clear. This is therapy. It's clinical psychology, and we use the art medium because it works on the unconscious mind, and we have the ability to tap into the unconscious mind a lot easier than the normal talk therapy can. So no, you don't have to have artistic skills at all, because again, we don't focus on the end product like an art class. We focus on the process while we're doing art with our clients, or while our clients are doing art with us. So what we focus on, what kind of art medium did they choose, what colors they chose, and why. What does the image tell them? Can we have a dialogue with their image? What can they say about their image? We do a lot of free association, like, why did you do this? And what is the reason? We talk about, what if you were to change your image? How would you change it? This could be through lines. It could be through any shapes and anything. It does not have to be necessarily. Again, we don't focus on the end product. We focus on the process of doing the art with our clients. And most importantly, we focus on building rapport with our clients, because that is the first and foremost thing we do in therapy.
Perfect, perfect. Sounds so interesting. I have a small question here because we're talking about colors and the color usage. So, does that also signify that the colors picked up by the patient or the client also defines their emotion or their present moment where they are standing right now? Because, as you said, the process matters, not the end result.
Absolutely. So whatever color they choose, they could tell me why, for example, they chose that certain color. There's a lot of people that have a lot of anger, for example, but again, anger is just one of the first readily emotions that are out there, that are so ready for us. We have access to a lot more than what's the secondary emotion, which is, why are you angry? So what we do as art therapists, we look through the deeper meaning of anger, which is, the majority of the time, it's based on fear, disappointment, or frustration. But the colors, where do they come in? For example, if they want to explain, anger. So what color would you use, for example, that would help you, explain or depict anger in your pictures? For example, majority of the time, it could be red or black. It depends. So we would have a discussion about that color, where they feel it in their body, and where it's really, really coming from. That's the whole thing about art therapy. It really reveals the client's deepest thoughts and feelings through art, because it's all about the unconscious mind, which is 95% of our brain.
Wow, that is so interesting.
It is.
Okay, coming to the third myth. Art therapists can figure out their clients from the picture they draw. I think part of it you've already answered, saying that the shape, the color, and why they have used. If you ask or probe questions, you will automatically know why. So I think a part of it has been answered. But would you like to answer
But
this too?
I do want to stress on the fact that no, we can't figure our clients out by just their images, because again, as a psychologist, I look at the whole picture. I look at the person
Mm-hmm.
individually in a holistic approach, as in their biology, their genetics, the biopsychosocial model, their environment. How was their environment? How did their environment affect them? What is it about their environment that affected them? So it's a lot of issues. And when they do start drawing, for example, based on, structured directives, art intervention, I cannot read the image. I can help them analyze, with free
Okay.
association with clients, what that means to them. Why did they choose a different color? And I think we did tap into that a little.
Yes,
Yeah.
indeed. So our third myth is busted as well. The
Yes.
fourth myth: art therapists can. Okay, no, that is done. Art therapists are not real therapists. I'm sorry, but this has to be a myth. I mean,
Ah,
this just
totally.
cannot
Yes,
be
I know.
anything.
I can't.
Absolutely.
Well, first of
I'm
all,
sorry to ask this question,
no
even,
worries at
but
all.
that has
You
been coming
cannot
up.
deal with. I totally understand. It's fine. Definitely a myth. It's a misconception. We have to
Completely a
deal
myth.
with people. First of all, you have to have a master's degree in clinical psychology to be able to deal and help people with their problems, with their trauma, with communicating with their internal processes and their emotional conflict. So, um, yeah.
So, without being an expert, an art therapist cannot be categorized as just an art teacher, but she is a
No,
therapist who's
absolutely,
actually studied
absolutely,
psychology.
exactly.
Yeah,
Because
absolutely. So,
art teachers are completely different than we're
art
psychologists. We just
therapists.
use, yes,
True.
we're art therapists, we're psychologists, but we use the art media, medium in
Medium.
order to help our clients process their images. And like I said before, with art, it has access to parts of the brain that normal talk psychology doesn't. So that's why we incorporate art in our therapy,
Treatment.
in our
Therapy.
treatment. Yeah,
Yeah. Therapy,
um,
treatment. Yeah. Whichever way.
exactly. So that's how we
Right.
promote healing, and we have the clients tap into their unconscious mind and their deepest thoughts and feelings.
Perfect. Perfect. Thank you so much, Nada.
Sure.
Another question, another myth rather, an art therapist won't be able to talk through problems with their clients. I think this also is connected to the last question. As you said, an art
Yeah.
therapist is already a therapist. She is also a
Have to be, yes,
psychologist.
you
So,
have to have a master's degree in order to deal with people. But I'll tell
absolutely.
you something about what we do. Most our work is really the major focus of our work is building rapport with our clients. That's one of the most important
Mm-hmm.
things we do in therapy, because the majority of the time the clients would mimic their experiences with their therapists. So if they have, for example, uh, abandonment issues or neglect, so we kind of act as uh, for our clients to have more trust in us, so we create that rapport with our clients to have that trustworthy relationship together. And we provide our clients with self-expression. We focus on, again, the creative process, which we don't care again about the end product, we care about the process. Again, we focus on communication with our clients, a lot of communication. The image uh, talks a lot by dialogue, and we can communicate a lot with our clients. We focus on their internal processes, and most importantly, trying to reconcile inner conflicts or emotional conflicts, because we talk a lot about emotions, where they're coming from, where they feel it in their body, and half the battle is knowing where you're coming from
Perfect.
and what your
Perfect. I
issues
think
are.
that itself answers. Yes.
Yes.
One more very interesting question. I think this has also come up from many people. Art therapy is only meant for children or people with developmental issues. Absolutely
Um,
myth, right?
100%. First of all, the majority of it works great with children that have autism or that have neurodevelopmental cognitive disability. It works fantastic with them, but it also
Mm-hmm.
works great with adults. Actually, the majority of my clients are adults. I have clients that have major depressive disorder, that came from a severe trauma experience and background, high severe anxiety. Um, Stress, depression. I mean, it's
All of it.
you can even see a therapist because you know what, you're wanting to cope with life's adversities and challenges, and you would like to speak to a therapist or a psychologist and how to deal with everyday life's challenges and adversities.
Thank you. Thank you so much. Even I think this was the last myth that was to be busted, which we got from audience. I would like to wait for questions coming from audience. In the meantime, Nada, do you have any take-home message for our audience?
Yes, since this is about anxiety, medication will not solve your anxiety at all. So I know we busted that myth when we started the session, but really trying to have the right, combination of lifestyle, incorporating it in your everyday life, that is a great way of coping with your anxiety, developing coping skills and coping strategies in order to have the ability to deal with your anxiety. It could be through, many things I've mentioned. Journaling is a great way to decrease your anxiety, because you can write down in your journal, for example, your problem. Once you step away from your problem and you come back to it, rest assured, the majority of the time you will read what you wrote and you would be like, oh my God, I actually blew things out of proportion. Or I should, it's like seeing your problem with with a different perspective. So that's another great way of coping. Grounding techniques, using your five senses. So there are many things how you can do on your daily basis where you can decrease your anxiety.
Rightly said by you. We have to be mindful, we have to exercise, we have to practice our self-care regime to remain that,
Absolutely.
keep ourselves in complete control. That's
Absolutely.
so
And
true.
sometimes
So
it
well
just takes
said.
breathing techniques, like 5-minute breathing techniques,
Right.
even less, a 3-minute breathing technique, like really breathing deep breaths, holding them for a couple of seconds, and then, exhaling for a couple of seconds, or exhaling it all out and holding your breath for a couple of seconds and redoing that repetitive again. So yeah, repetition is key, trying to, like I said, incorporating good stuff in your lifestyle, especially, what, mindfulness is really, really important because you're really trying to focus on the present moment. Rest
On the
assured.
now.
Yes, absolutely. On the here and now, rest assured,
Absolutely.
anxiety comes from anticipating future events, and that creates a lot
True.
of fear and anxiety. So, trying to get your brain, your mind into thinking of the present moment, of now, of what you're doing now, how you're going to go about your day. That helps a lot with staying in the present moment.
And venting it out in a while journaling, I think is also a great way to keep yourself
Absolutely.
grounded.
Yes,
So
because you're
so well
focusing.
said.
That's another way of mindfulness and being in the present moment, by journaling, because you're focusing on
Absolutely.
yourself right now, by
Now.
writing. Exactly.
Absolutely.
Yeah. So that helps
So
too.
so well, so much, so many tips that me and my audience have gathered already. I don't see any questions yet. Nehal, do let me know if there are any questions, but I don't see any yet here. Any other message, Nada, that we have missed, or anything else that you would like to add on for our audience here, whoever is present?
What would I like to add? Well, I've covered pretty
Take
much
home
anxiety.
message.
A take home
I think
message.
yes, you have already take home message.
Yes, the most important message, besides being in the present moment, is really watch out for your self-talk, because I think that's a lot more damaging that when we actually think, that little inner voice that keeps talking to you that you're not good enough, you're gonna have a bad day today, or that person doesn't want to talk to you because for whatever reason, that, inner critique, that self-talk, really be very aware of it, because that could be very, very damaging. Try to pick up on, when you start talking to yourself in a negative way, trying to switch it into a more positive way. Positive affirmations work great. For example, every day, when I wake up, for example, I say, I am enough. I'm going to have a great day. I'm going to do my best. I can handle whatever stress comes my way. Those are great, great ways to start your day. Being grateful as well decreases anxiety, and it has been
Absolutely.
found by a lot of research that being grateful for only 3 things during your day can really decrease not only anxiety but also depression. And that only takes 1 week. Imagine. So,
Wow.
every day, if you're grateful for, I'm sure you can find a lot more things you're grateful for, more than just, 3 things per day. But look how little, like noticing the small things, enjoying that cup of coffee, or having a walk on the beach with a friend, or whatever it is, those little small simple joys in life. Being grateful for that also decreases your anxiety and also your
On a
depression.
daily basis. Also on a very daily basis
Absolutely.
with
I
simple
cannot stress enough
steps.
on that, to be honest.
Absolutely. Thank you so much, Nada. I think it was a great session. I think there's so many learnings that we are taking with us. And
Absolutely.
any other question any of our audience has, kindly please leave it on the chat box, though I can't see any. So,
I can't either.
yeah, even I can't see any. So do let us know if you still have any doubts. Do message us. We will try and help you with the answers. Nada would help you. No questions
Absolutely.
yet. So
It would be
yeah,
my
it
pleasure.
was lovely. Yeah, it was an honor to have you with us, Nada, with
Thank
NHAP
you so much.
community.
And it was great being
Thank you
here.
so much. Thank you. Thank you so
Thank
much.
you. Thank you. Take care. Have a lovely rest of
Bye-bye.
the year. Bye.
Same to you. Bye-bye.
Thank you. Bye. Bye.
Bye.